Now, we applaud them from our windows. We're inspired by their courage. The healthcare workers thrust into the front line of the coronavirus crisis, risking their lives to save others. While we've been on air, news has come in of a 15th NHS worker who is dead and died. The death was announced today of a doctor who specialised in elderly care. Here are the faces of 10 of those who have lost their lives. They include nurse Thomas Harvey, who was 57 and lived in East London. His family says they feel that despite devoting his life to helping others, the care that he needed was simply not available to him. Our chief correspondent, Alex Thompson, has this report.
Larger than life, a phrase built for Thomas Harvey. A family man, as the photographs say, with silence yet eloquence. An NHS man, a nurse for more than 2 decades. But Thomas Harvey died alone, self-isolating. 4 attempts to hospitalise him refused by the National Health Service he had served for so long. He leaves his wife, Marcia, bereft and angry.
I'm trying to hold on for my kids, but it's very hard knowing that, you know, if we had gotten the help that we needed, he would still be alive today. But they failed us. NHS failed us. Working for them for over 20 years, they failed us.
Happier days, working over Christmas. Even on Christmas Day, Thomas Harvey would put his patients first.
He really pushed himself forward to go to work on those days. So we would always open gifts at 3 p.m. or whenever he got home.
His excuse was like, you know, we have each other as a family on Christmas, but his patients are sometimes by themselves. So he wanted to make sure that they also had, you know, someone to be with around holidays.
Thomas fell ill after treating a patient at Goodmayes Hospital in Ilford, who subsequently tested positive.
I've never heard breathing like that before. It wasn't normal breathing. Imagine an engine trying to get started, but like that's every time you inhale, you know, that's what it sounded like, and it just wasn't normal.
The family couldn't believe the man who'd barely ever missed a day's work for illness was failing. Again and again, they begged for him to be taken to hospital.
The first time we called, they said to self-isolate and to refer to the NHS website. The second time we called, that's when the ambulance came. But they said that his case wasn't bad enough for him to be taken in. The third time we called, they said to refer to the NHS website. We called one more time after that as well, and we were told again to refer to the NHS website.
4 times?
Yeah, we called 4 times.
Self-isolating in the front room, he staggered into the toilet during the night and collapsed.
I woke up, obviously, to my mum and my sister screaming. And yeah, so he had like collapsed behind the toilet door, which opens from the inside. So that's when I had to like punch through and like start ripping the door open so I could climb in. But like that, I thought the week before the breathing was bad, but the noises that he was making at that point was just like insane. And yeah, so by then the ambulance had just arrived with the police, but you know, it was too late.
Seen here with his siblings, the family wonders why Thomas apparently had no PPE protection when working. A former colleague confirms that to us. Goodmayes Hospital said no patients were exhibiting symptoms, though of course one subsequently did after Thomas Harvey fell ill. His family say the paramedics said their father was suffering from coronavirus, but with patchy testing of NHS staff, no one knows for sure, and they still await a test even after his death.
Who do you have to be to get the test? Because we've been seeing loads of celebrities post with no symptoms getting tested. We've been seeing loads of politicians, but yet we aren't seeing NHS staff getting tested for it. We aren't seeing people with severe symptoms get tested for it. My dad died over a week ago and we're still waiting for him to get the test.
One person, one life. Thomas Harvey gave so very much. He got so very little back when it mattered most.
I think all of us wanted him to see us do and achieve, and it just feels like it's been snatched away from us.
He was a great, oh God, great guy. I miss him so much, honestly.
Thomas Harvey, a symbol of NHS service in life, an emblem of its failings in death.
Well, tributes have been paid to a highly regarded heart surgeon who has died after contracting COVID-19 in Wales. Jitender Rathod, a father of two, was described as a very compassionate and wonderful human being. He died in the intensive care unit at the University Hospital of Wales in Cardiff on Monday. Our Home Affairs correspondent Andy Davis joins us now from Cardiff. Andy.
Well, staff were informed last night that one of their colleagues had died in the early hours of yesterday morning, having previously tested positive for coronavirus, and that he died here at the University Hospital of Wales, the very hospital, of course, to which he devoted so much of his career. Jitender Rathod was in his early 60s. He had two children. He was a cardiothoracic surgeon known as Jittu to his friends, and he'd worked for the Health Board on and off for around 30 years. I understand that he'd been self-isolating for a lot of the last month and that he hadn't been working at the hospital prior to his admission. The First Minister of Wales, Mark Drakeford, said this was desperately sad news and described him as a very highly regarded doctor. The chief executive of the Health Trust said he was devastated by what had happened, and early this afternoon he had this to say about the surgeon.
He was a much-loved colleague. He was one of those colleagues that everybody talks very positively about. I've had texts and messages sent to me over the course of the last day, and in all of them it's about how much people really liked him, felt supported by him, and he was one of the pillars in the organisation. So a real loss to us here within Cardiff and Vale.
Len Richards went on to say that they had around 160 patients at this and another of their hospitals who've tested positive for coronavirus, a minority of whom are in intensive care, and that roughly the numbers they're seeing are doubling every 4 to 5 days. But currently their capacity is good and that they're coping well.
What's the latest on testing in Wales, Andy?
A new drive-in test centre opened in Cardiff today by appointment only for social care workers, police and prison staff. They're going to be opening another 3 such centres across Wales in the next 2 weeks. On average, about 200 tests per day at each centre. And all of this part of the Welsh Government's drive to increase their testing capacity from 1,100 a day to around 4,000 a day over the next 2 weeks. That, at least, is the ambition of the Welsh Government.
Andy Davis. Well, joining me now from a hospital in East Anglia is Daniel Elia, a locum doctor currently working in a COVID unit attached to an accident and emergency department. And Daniel, I can see you're surrounded by colleagues as well. If any of them would like to add to what you're saying, we'd be delighted to hear from them as well. I mean, we've just heard 2 heartbreaking stories of NHS professionals. What is the situation with your unit? Do you have all the protective equipment and the testing that you need?
I think it's a tough one. It really, really is a tough one. We're here, we're trying to keep positive, we're trying to focus on the patients. That's our number 1 goal. But of course, you know, we're thinking about the PPE, we're thinking about the testing. I can only speak for myself and everyone's individuals, but if everyone here was tested, I'm sure, you know, the results wouldn't surprise us and we'll be able to react and respond to these results. We'd have confidence to say that, no, I shouldn't be here, or yes, I'm okay to work. I'm okay to be close or in proximity to patients. I'm not giving it to my colleagues. I'm not giving it to those around me. We do need testing. That's, you know, there's no doubt about that, and we need it faster. We do know that, you know, some tests have been rolled out, but it's just about speed, you know, and we support our government. We know they're trying their best, but we're just trying to give them an extra, you know, push to say, come on, let's move on. Let's move a bit faster. The next thing is PPE. Again, you know, we do have some PPE. You know, we do have some measures to stop the infection, to stop infecting us and other people infecting other people. But we want the best. We want the best. And right now, we're not getting the best. And that's the way it is. I'm not sure what you guys think.
No, I think think it's a scary time for everybody, and I think this is something that is affecting doctors, healthcare professionals on a global level. In terms of like the support that we've got from everybody and the encouragement that we're receiving, it's truly humbling. And I think that in the hospital, the vibe is also very sort of looking out for each other, looking out for other healthcare professionals, and making sure that everyone is wearing the correct equipment and working together. So currently I'm at the COVID unit alongside Daniel, and I think it's always quite nerve-wracking when you're seeing a patient who's suspected COVID or tested positive for COVID. But I think that the most important thing is just to stay positive, be sensible, to wear your proper PPE equipment, and I think just to fulfill your role as a healthcare worker. And I think that the support that we're getting from everybody has allowed us to do that. And it's just a matter of pacing ourselves and trying to stay calm amongst the storm, which I think that as a hospital, as a unit, we're doing quite well, I'd say.
What is the situation on capacity? The government keeps saying at the moment capacity is greater than the number of patients coming in. Is that your experience where you are?
So I mean, it depends where you are. Different places have different levels of COVID around. We can't compare ourselves to some of the more busier places. But right now, us personally, we do have capacity to see patients, and perhaps the measures that the government have taken and that we've taken to stay at home are trickling through, because we do have capacity, and perhaps that curve has been flattened because we are dealing with the patients coming through.
And so
absolutely. I think the measures, just as Daniel was saying, that have been taken, you can actually see that when you are working in A&E, and it's good to know that the general public are really sort of doing their best to try and control and maintain this pandemic as best as they can.
And how easy is it for professionals to distance yourselves from each other? I mean, obviously you're all crowded around a computer screen right now. I mean, is distancing something you're able to do in hospital?
I mean, it's the rule and the guidelines, but we've got to be realistic. If we're crowded around a patient doing CPR, if we're close to a patient, if we're around a computer, we're going to try our best. We're going to try our best. And we are social distancing here. You probably can't see it on the screen, but we are trying our best. But we've got to be realistic, and being in a hospital, working in close proximity, we have to be realistic. That's all you can say about social distancing. But it is a measure that everyone should take as much as they can. It is important.